I would like to remind you that this 90-minute webinar is now has started. Please use the chat function to let us know your name and where you're coming from, so we get to know each other. And you might also want to interact with the panelists and the other participants in the chat box. You can use the Q&A function for all questions and recommendations. So we are part of the United Nations University International Institute, the United Nations University network, which is the, let's say, academic network from the United Nations. We are a kind of a think tank whereby research, education, capacity sharing, policy dialogue and advocacy is being done by 14 institutes with the headquarters in Tokyo, Japan, on several issues relative to global development. We are the institute working on global health. We are based in Malaysia, hosted by the University Kebangsaan Malaysia in Kuala Lumpur. And being the think tank working on global health, we interrogate and work on issues relevant for health and development. We have started a new strategic plan since last year, working on power and accountability issues, gender equality issues, digital health security, and also climate and climate justice and health. I'm the research lead of the climate justice and determinants of health work package that has started this year, and this is actually our first webinar in that series. So I'm really pleased to be here with you. So the way we work at the International Institute for Global Health is that we, through looking via several lenses at these global health problems, the lenses being power and accountability, feminism, intersectionality, decoloniality, contextuality. We try to see how the more structural determinants of health can be improved or altered or dealt with in a way so that current challenges that are via the poly crisis that we see and the geopolitical difficulties that there are, the planetary, let's say, instabilities that we face, that they are being addressed. So we're really trying to look more at the upstream determinants of matter, and in a way also would like to work with like-minded actors, both in the global north and in the global south, but very much focusing on let's say, capacity sharing with those voices that have not been heard. That's the way we like to engage with our work. Now for today, and I'm calling in from Vietnam, Hanoi, where I am at a regional conference on climate and health, hosted by the NGO Healthcare Without Harm. So it's to say that the climate escalation and how it's felt is very visible. Huh? We just had the hurricane Yagi going over this area about a month and a half ago, and the typhoon Tragi, which hit the Philippines a couple of days ago and is now here in Vietnam, is also causing floodings, and even here in Hanoi, quite some rain. So it's very visible. It's 12:05. There's urgency, and the urgency is really in thinking about how to transit into economic and health systems that are doing well for people and planet. And so for today, we have an excellent panel from across the globe. I'm very pleased that you could make it to discuss these matters, and especially how health sector actors could interrogate with you on this. So for today, we really would like to hear about how from different places this is done, and also that how we can move beyond the adaptation paradigm and really transform, and how action by health system actors can work out. This seminar was originally planned at the Health Systems Global Symposium in Nagasaki in Japan in 2 weeks from now. Due to financial and logistical reasons, it was a bit difficult to bring all the actors together. But we would like to start that debate here now, and also to engage with the wider health systems researchers and professional community to create a kind of a knowledge base to take this further. We have an excellent panel. I will give the floor now to the moderator, who will also frame a little bit the session, which is Marta Schaaf. Marta Schaaf has spent 20 years at the intersection of health and human rights, engaging in research, advocacy, and program management. Being now the program, and she leads a program on climate, economic, and social justice and corporate accountability at Amnesty International. She's worked and consulted for WHO and was a lecturer at Columbia University's Millman School of Public Health. In her free time, Marta is a parent climate activist in New York, and so she also sees firsthand the influence that private actors have on population health and legislation. Marta, the floor is yours.
Thank you, Remco. Good morning from New York City. Good afternoon, good evening to folks elsewhere. I'm just going to provide some very brief framing remarks for the discussion we're having today, and then pass it over to our panelists, who are going to be the heart of the discussion today, talking about their work. And hopefully we'll have ample time for question and answer to reflect on that. So, as Remco said, we're here today to talk about the role of healthcare providers in the broader health community in addressing climate change. So as Remco alluded to, and I'm sure everyone here knows, climate change poses an existential threat to humanity, and it also causes enormous harm to population health. In 2 days, on Wednesday, we're going to see the next Lancet countdown on climate and health that will be launched, and it will likely explore physical and mental health morbidities associated with heat, flooding, drought, food insecurity, wildfires, changing disease exposures stemming from global warming, and more. I also want to mention the mental health burden of climate change, particularly on youth, and we see studies proliferating by the day, revealing high numbers of youth who report that climate anxiety disrupts their ability to function normally. But as many of us on this webinar know, I think this anxiety is not confined to youth, right? It affects people who observe the impacts of climate change in the course of their everyday life, people with basic scientific literacy who follow the news, and those of us who see it arrive in our work, who understand how close climate disaster is. And one of the, another fact that's been emerging from studies throughout the world in countries at all levels of income is that taking climate action, doing something, is one of the best balms for the climate anxiety that people feel. I also want to note that the primary cause of climate change, fossil fuels, also themselves pose direct risks to human health, right? Not just through climate change, from air pollution to the poisoning of drinking water and many other avenues. So fossil fuels and climate change pose a growing challenge to health systems, which are, in some senses and in some cases, worse off than they were a decade ago. Declining morale amongst the workforce, and austerity health and social protection budgets stemming from the COVID-19 pandemic and the subsequent inflation and the erosion of the social contract mean that some health systems are poorly equipped for the next disaster, or for chronic disaster conditions, which we're increasingly facing. Inflation continues to deepen the debt crisis, with creditors in high-income countries raising their interest rates to control inflation, such that low-income countries must pay higher interest on their debt. So this is making debt payments higher and higher, and the fiscal space to fund healthcare systems and social protection in many low and middle-income countries decreasing. So, to address this wider issue and the more micro-level issue of climate, the global climate justice community has converged on climate finance as the key priority at the upcoming Conference of Parties to the UN Framework Convention on Climate Change, or what we typically refer to as the annual COPs, right, that occur every year, that will be in Azerbaijan this year. Climate finance entails funding from higher income historic emitter countries to the lower income countries bearing the brunt of climate change. Finance should include funding for mitigation, which means fossil fuel phase out, and the construction of accessible renewable energy infrastructure, including for the millions of people who currently lack access to electricity. And finance also includes funding for adaptation, which refers to efforts by governments and communities to adapt to the climate change that is already here and that is already too late to stop. So importantly for us, climate adaptation may entail investments in health systems resilience so that the physical infrastructure and the human resources of health systems are able to deal with extreme weather, such as heavy rains and flooding, with population level events stemming from unnatural disasters, and with changing disease patterns. Overall, there has been too little funding that's gone to adaptation, right? So many high-income country governments and advocates fail to recognize the toll that climate change is already having, and they focus investments on far-off solutions, or even worse, on continued fossil fuel extraction. So lack of investment in climate adaptation in lower income countries has emerged as an urgent social justice concern, right? Climate change is here, it's already baked into the climate system, and we need to do something now to limit the damage that it causes. At the same time, many prominent global health actors highlight this underinvestment in adaptation and argue for climate adaptation and health system resilience without acknowledging the drivers of climate change. So for example, the Communique at Health Day at the last COP in the United Arab Emirates did not mention fossil fuels. And many of the leaders in the global health community are funded, or the folks with most power, let's not say the leaders, are funded by private foundations that are typically reluctant to study, name, and address structural causes, ranging from racism to fossil fuels, right? There are many different upstream drivers. Healthcare providers and professionals, on the other hand, hold enormous professional legitimacy. They see the harms of climate change in their work, and they understand the stakes. So from Virchow, one of the early epidemiologists, from his development of the concept of socio-medical causation of disease, to tobacco control, to fights against big sugar, to the latest social epidemiological research on racism's harm to health, the health community has fought for concerted attention to upstream drivers, right? This wasn't always the initial reaction, but we have been protagonists in calling attention to the causes of the illnesses that are seen on a population level. So on this panel, we'll learn more about the role health professionals can play as protagonists in the fight to phase out fossil fuels and to ensure that health system resilience is a robust concept that goes beyond just making do with less in times of stress to actually gaining more resources to make the health system a more effective and accessible provider of curative and preventive care. So I look forward to hearing from my fellow panelists' experiences. As Remco said, we've been talking about this panel for a long time. It's gone through many iterations, and I'm glad that we finally arrived at the day. So we're going to start with Paola Johns, and colleagues from UNU are going to put their bios in the chat so that we maximize time for hearing from their experiences and for Q&A. So I'm going to pass it over to Paola Johns, who's normally in Brazil and is with ACT Health. Thank you, Paola.
Yeah, hello everyone. Good morning, good afternoon, good evening, or almost good night for some people, perhaps. Well, it's a pleasure to be here to discuss, the really urgent issue for all of us. So I'll start by talking a little bit about where I come from, what we have been doing, and how I see the importance also of health professionals, what role they have to play in the poly crisis that have been already introduced by both Remco and Marta. It is really challenging. So I'll start by saying that I think in terms of responding a bit to this climate anxiety and everything, ACT Health Promotion originally was a tobacco control organization. So we have been following the Framework Convention on Tobacco Control from the WHO negotiations, and then later the implementation in Brazil. And I remember in the early days of the tobacco control movement that there was something, it was actually sponsored by WHO, which was called like it was where I got one of my first scholarships in the very beginning, the early days of like mobilizing a broad alliance in Brazil to act on tobacco control, which was called Channeling the Outrage. And it was about the outrage of the practices of the tobacco industry, which became so evident during the negotiations of the treaty. And I'm saying that to make the point that actually once we identified what was going on in terms, okay, you have this really powerful economic actor, commercial actor that is doing everything it can so that at the end of the day, we get the weak as possible treaty in terms of like controlling this global epidemic, that there was this realization, like we need like global measures to deal with like a global epidemic. And then during the negotiations process, I'm introducing that to talk about the commercial determinants of health, I think, which is a key element for what we are discussing here now. It was during the negotiation process of the Framework Convention on Tobacco Control that delegates, which took like 2 to 3 years from the hearings, the initial hearings, till the negotiation started, it became really clear to delegates that like this industry interference was really, it will not be feasible to move ahead if there was no measures to actually tackle and deal with the industry interference. So the Framework Convention has specific guidelines on how to manage and mitigate conflict of interest, which I think it's a key issue to deal with the other like health issues and crises, the polycrisis scenarios that we have in the world today. I think from there to today, it's been like 20 years now. Was it last year? Yeah, last year was the celebration of the 20-year anniversary of the entry into force of the Framework Convention on Tobacco Control. And it was like that what really made the difference. And what people start like realizing, particularly in the health field, and particularly in the issue of like risk factors for non-communicable diseases, and that I'm talking about besides tobacco control, also alcohol consumption, malnutrition in all its forms, and lack of physical activity, and air pollution. All these risk factors, they have behind them like really powerful economic actors, just like we had in the area of tobacco. So one of the reason also, as an organization, as a coalition of organizations, as leaders of a coalition in Brazil, we expanded from tobacco control to deal with the other risk factors for non-communicable diseases, really because we had this experience in the field of tobacco and how to tackle and how to deal with like the tobacco industry, basically. And actually you need to do the same, some of the same. We are talking about like some of similar policy issues that are useful for all of them. And you are talking about very, very similar dynamics that are the major like barriers and challenges that we have in order to enact like reasonable, effective policies to reduce the exposure to those risk factors, right? Because we always operate in the thing, okay, the focus should not be on individuals, but the focus should be in the environments that we as individuals live. We are born and we live and we die in specific environments, and these environments can enable or not healthier or unhealthier practices, right? Or what some people like to call lifestyle. I think it's really not that much of a lifestyle that is chosen by us as individuals. I think it's a lot to do with the environment we live in. And the policies we are talking about are actually restricting marketing of unhealthy products. We are talking about raising prices and taxes of those products, which also can have like the beneficial effect of being able to reinvest it in health. We are talking about having really honest and through information for consumers. That could be through labeling. In the case of cigarettes, we have like this like warning labels in the package. We also having similar initiatives in the area of like for ultra processed foods. Many countries, particularly in Latin America, are using like warning labels like about the excess of like critical nutrients in these ultra processed foods. And we are talking about healthy environments, so we can talk about like schools, and in the case of cigarettes, we're talking about smoke-free environments. In the case of the other ones, you also talk about like particularly food, you're talking about like, for example, school meals programs that can be really effective in two ways, both in protecting children and guaranteeing access to healthy foods, but also like preventing from buying, like being able to support some agri-food systems that are healthier for our health and for the planet, right? So we are talking about buying procurement from small-scale farmers, which is a very important thing when we think about like, now I'll jump from like agriculture and food, because I think it's a really, really good example of like this connection between health and climate change. If we look at the agriculture food system, if you look at food systems today, I think it's about 70% of the current like hegemonic food systems, agricultural system is responsible for 1/3 of the emissions for the greenhouse effects. So agriculture plays a major role. And we live in a scenario in which, if we know about, I think the figures I have, it's like we have like around like 77,000 things that we can eat that are from nature. And out of them, we know how to cultivate about 400 of them, but actually 75% of the calories that are consumed today in the world, they come from 6 crops, which is a bit like, it doesn't make any sense, neither in terms of like biodiversity, because it's not, there is the climate crisis, but it goes hand in hand with the biodiversity loss crisis, right? So we have like this polycrisis scenario. And this is really strongly linked with like, okay, what is it that we are eating? I think food, it's really a key thing. Like food makes us, we are what we eat, and the world is what we eat as well. It's not only us, again, as individuals, right? So this type of like agri-food business, the way it's like the hegemony of like this really single crops and commodities for export. And coming from Brazil, we are major exporters of soy, and we have like the potential of growing food from small landowners, which is amazing, but we actually don't do the right policies for that. And I'm saying that to jump into why is it like that? We are at the moment in Brazil, as an example, discussing a tax reform, but the sectors that are actually responsible for the crisis, the climate crisis, the loss of biodiversity crisis, Brazil was on fire. It's been on fire the last months. It's really a major disaster. I think Renko just mentioned like the disasters that are in Asia, and I think it's going on all over the world. And it's really largely due for the promotion of soybeans and sugar and exports of sugar and soybean and corn. So this is all interconnection. And then when we discuss like actual policy making, it's like what policies would make sensible. We see that like all the subsidies, they're still going for those commodities for export, and the amount of financing and incentives and subsidies for like really diversified small crops and small landowners, it's really nothing in comparison. And obviously it's those same actors, they are the ones that are lobbying for the system to be as it is today. And we all know we are here not for other reason, just then to say that, well, business as usual is simply not working. We need to make like some structural changes. And that is pretty much about at the macro level. It's pretty much about changing like this structural determinants, which are, we need more regulation for the commercial determinants of health, which have a similar dynamics for all these risk factors that I mentioned earlier. And we need to have some financial system, in the sense that where is it? And it doesn't pay to do good, right? And the best example for that is that like a small farmer can hardly survive, even if you have a land to grow. It's really hard to survive if you grow like healthy and clean food in comparison to having thousands of hectares of like soybeans for export, which you get so much heavy subsidies, which is why it's a big success. So we always, I think we need to look at what is the financial system behind those structures that make it like continue the way it is. And then when if we go like from the production to the consumer side, again, those like it really pays off to promote ultra-processed foods. You have lots of marketing in terms of like the evidence about ultra-processed food. It's as stronger as never. I mean, it's really strong in terms of what's the impact on our health, but not only on our health and also in the planet. And then we can talk about like plastic. We can talk about all the entire chain that it's related to like the production of ultra-processed foods. And I mean, the same lobbies in the consumer end are together with the lobbies from the producers end. In the case of Brazil, and I guess this is similar in other places. So they are joined together, lobbying against any measures that will make sense in terms of like putting some limits or making like the fair play among like being a small one or a big one. Like if you're a small one and you become minimally successful, you are immediately eaten up or bought up by a big major corporation, which basically, then we go back to like the macro structure, they basically don't pay any taxes, right? Multinational corporations today, they can use so many fiscal tricks, or I don't know the exact word for that, the exact term, but they can use so many like maneuvers, like fiscal maneuvers, that at the end of the day, they pay no taxes. So the entire system like needs, I think it needs both like the structural changes that needs to happen at the global level. And I really think it's very, very important. I'm very happy to be like at the United Nations University event, because I think it's really important that we strengthen the role of like multilateralism in the world today, which is not the same as it was 20 years ago when we finalized the Tobacco Control Convention. We were in a better place in that sense. I think multilateralism it was stronger than it is today. So I think there is the crisis is also about that. And then I'm really not sure about how much time I have left, but I want to say a word about health professionals and the role that they have played in terms like both in the tobacco control movement, not only globally, but also like at national level. I think the importance of health professionals, both in terms of the credibility that they have with the population for like spreading the message, right, and credible information, but also because I'm come from an advocacy organization, as an advocate, the voice of health professionals supporting the policies that we are trying to discuss and push for is very, very important. And it's key, and it makes a huge difference when you're talking with like a parliamentarian or anybody like the decision maker at the policy level, that you have like the voice of the health professionals with you. I think they are the most, in my personal experience in lobbying for tobacco control legislation and other legislation, the voice of the health professionals is always the most credible one. And then a few words about like, right now we are in the middle of negotiations, a plastic pollution treaty. I mean, all these issues, they're absolutely interconnected. And healthcare without harm, it's playing a wonderful, a beautiful role there in terms like, because you want like the mindset for the overall negotiations, just like, okay, we're just talking about recycling, right? I mean, I'm being a bit like extreme here, but it's just like, it's really hard to discuss the more structural measures, because we're talking about fossil fuel at the end of the day, and the voice of the major fossil fuel producers is very strong there. And of course, everybody's kind of using health as the argument for all cannot do about plastic, anything about plastic, because it's so important for health. And I think healthcare without harm, it's playing a really beautiful role in sense, okay, hold on a second, you cannot get an exemption, just like a blank exemption for health products, because it's not like that it works. Let's do something about that. So I think it's important to bring that up, because I think it makes a huge difference when the sector that is being used as a kind of as a almost as like, oh, don't do anything because it's good for health. And if you look at the propaganda that the plastic industry is doing around the treaty negotiations, it reminds me so much of the tobacco. It's the most horrible kind of pictures of like a child with breathing whatever equipment saying, oh, this plastic saves lives. So it's a complete like, so overall, besides the problem of the financial system, we have like this entire like possibility of like this fake news and all this like this propaganda funded by those actors, right? So which is also an important element. So I think I'll stay here so we have time for debate. There are still many other people to talk. And my final message is we really need to channel our outrage, because I think we can do differently. We know what needs to be done, and we need to be more people from different areas working together for that to happen. And thank you for being here.
Thank you so much, Paula. That was fantastic. You did a sort of, in 10 minutes, a social ecological model of Brazil and transnationally, and brought up taxes as a possible lever, a policy lever. And just for everyone here, there is a negotiation happening now for a binding UN tax convention as well, to address some of the challenges that you brought up, and your focus on plastic and ultra-processed foods as in industry efforts to frame these as individual behavior issues rather than as systemic issues. So that was really enlightening and done very tightly. So thank you. And I'm going to pass on now to Mafoko Pomone, who's from Groundwork, an NGO in South Africa, who will share her experiences. Mafoko.
Thank you. Thank you, Mata. I'm going to try and share my slides. I have a few slides. Please let me know once you can see my screen. Perfect. Thank you. Yes, thank you, Martha, for that introduction, and to Paula for her presentation as well. So I'm going to be sharing a little bit about a case study from South Africa related to air pollution. Just by way of introduction, we are an NGO called Groundwork. We're based in South Africa. Our work is rooted in the 6 campaigns you see in front of you. Is the climate and energy justice campaign, the coal campaign. I am part of the environmental health campaign. We also have a waste campaign. We run an annual environmental justice school through the environmental justice education. And through Healthcare Without Harm, our partner, we work on global green and healthy hospitals. Primarily, our work is rooted in trying to demand environmental justice for communities affected by various environmental injustices. I work primarily on air pollution. And just to give you a snippet of, the situation in South Africa, we are reliant on coal heavily to generate electricity. Our economy is based on an energy paradigm called the mineral energy complex. And this has led us to being the most energy and carbon intensive country in the world. And so the reliance on coal as its primary energy source is quite rife through Eskom, which is our electricity public utility. And this organization owns and operates all the coal plants in the region. And this region is home to about 12 coal-fired power stations. And so the coal plants and oil refineries are the major sources of pollution in the region. Air pollution has been a feature of the landscape since the 1950s. So it has been a while. And this province and this location is also home to a lot of socioeconomically marginalized communities. because we're an environmental justice organization, we draw on, the Constitution, a lot of legislation. We also draw on, the WHO equality guidelines, and we are known to for our emissions to be in exceedance of the WHO, equality guidelines. Specifically, our constitution is quite strong in sort of outlining various rights. Specifically, we draw on Section 24, which refers to everyone having the right to an environment that is not harmful to their health or well-being, and having the environment protected for the benefit of present and future generations. So our work is really rooted in Section 24 that speaks to an environment that is not harmful. A lot of rights, we also draw on a lot of rights in our work, the right to human dignity, the right to life, the fundamental rights of a child when we do our advocacy. And so we also have the National Environmental Management Equality Act, which really gives guidelines around, minimum emission standards. And this is really what shapes our work. In 2007, this specific area was declared a priority area. This was through various interventions by civil society to sort of say, we're breathing dirty air, what can the government do? And so the government then declared the area a priority area. And this meant that they were acknowledging that the area was in exceedance of minimum emission standards, but also the air quality, ambient air quality standards. And they then developed air quality management plans that were then meant to ensure that the area and industry is in compliance with the emission standards. And this is home to about 3.6 million people, and the kind of area is like around 31,000 kilometers, which is a highly polluted area. Having declared the area priority area and drawing on the health-based ambient air quality standards, the expectation of communities was that then industry would be brought into compliance and their health would be prioritized. But unfortunately, this is still not the case, and the environment remains toxic and continues to destroy the health and well-being of the people that live in this area. And so where healthcare plays a role is that we draw on various health experts to then provide evidence around the health impacts of air pollution. In 2016, we approached an air quality and health expert, Dr. Mike Holland, who then conducted studies and modeling around trying to attribute the air pollution from these specific Eskom mines to the health impacts, to how hospital admissions are attributable to air pollution, but also lost working days per year of the people that are impacted, and how then ultimately this impacts on the health system and budgetary constraints. And so the total cost associated with these impacts exceed 2.3 billion per year, and this is in US dollars. So this study was fundamental in providing evidence that led up to support the deadly air case. So in 2019, then it took a long time for the air quality management plans to be published. These were published in 2012 after the area was declared a priority area. And as mentioned, the aim of the air quality management plans were to ensure that there's compliance with all health-based national ambient air quality standards. And so there are various goals that were outlined in the air quality management plans. And the failure of the government complying led to civil society taking the Department of Forestry, Fisheries and Environment to court. And this case was then referred to as the deadly air case. Two NGOs, Groundwork and the Vogani Environmental Justice Movement in Action, were represented by the Center for Environmental Rights. And the case was filed on grounds that the government has violated the constitutional right to a healthy environment for the people living and working in this priority area. And so by failing to improve the deadly air and the air pollution in the region, there was then the request that the government is in non-compliance, right? But most importantly, they have breached the people's constitutional right to live in an environment that is not harmful to their health and well-being. And the court declared that the air quality constitutes a violation of the people's right. And so this was a last resort that communities then voted to. And in 2022, the court found in the people's 2021 rather, in May, the court found in the people's favor, and the court ruled that the minister had to prescribe the regulations that would make sure that the air quality management plans are implemented. And unfortunately, the minister appealed this judgment due to a technicality, right? The Air Quality Act states that the minister may make regulations, but the court held that, the may effectively means must, but the minister was appealing this technicality. And currently this is being the appeal was heard in August, and before the appeal was heard, the current minister only then published the regulations, which the two NGOs, Groundwork and Vogane, are currently reading and studying the regulations to determine if they are adequate. And should these regulations fall short, we may consider another legal challenge. And the judgment and these developments come at a critical time where legal air pollution protection is under severe threat, where we're seeing the major polluters being granted exemptions. These major polluters have sought and been granted suspensions of compliance with minimum emission standards. And we know that these standards, as I've mentioned, are intended to control and minimize the levels of various toxic pollutants, such as sulfur dioxide, nitrogen dioxide, and particulate matter. And so, in essence, what we're seeing is that the illegality is being made legal by these emitters being granted exemptions. As far as the health community is concerned, we are of the view that there needs to be some form of restorative justice for these communities. We want health professionals to be involved in the politics of energy production, have them visible in discussions around that are based on fossil fuels, the just transition, and really lending their voice and evidence as they have done in the past. They're trusted, this has been said, and the evidence that they provide is crucial in ensuring that policy is being developed, but also being implemented. So we've embarked on various research, also community participatory research, in trying to make the case for there to be a health plan that is developed specifically for these priority areas. Firstly, to ensure that health services are fit for purpose, because currently there is no air quality and health framework that recognizes that these communities then deserve specialized services that are focused on respiratory illnesses, but also that health professionals in these priority areas are specifically trained in order to develop early warning systems, but look at children who are very vulnerable, but also amplifying the voices of communities as they are first responders, and they're able to then have an insight into what they're seeing. So we've looked at also the need for health systems resilience. So not just health service provision, but also looking at, is the health system resilient in facing climate related issues, and specifically air pollution. And we've looked at, you know, what a health plan could look like that then speaks to restorative justice for these communities. And this is really a huge advocacy area for us as part of the environmental health campaign. And through our various coalition partners, this is really what we're trying to amplify. And this year we conducted a community participatory research where we had young people living in a community called Paula, it's a mining town, actually conduct a community health screening, door-to-door survey to have a picture of what are the health impacts. And so we're hoping to use some of these research to then make a case for this health plan, but to really partner with the health sector to be in solidarity with communities in order to lend the voice and to not. Often you find that health professionals are shying away from the politics, and so this is an area where we're saying, you know, we need them visible. We need their expertise. We need their influence in sort of representing the health impacts that are visible for people that are impacted, especially by various environmental injustices, and air pollution being a huge area of focus area. And in essence, we're really trying to build a movement for health professionals for clean air, but specifically for climate action. We, through our partner Healthcare Without Harm, we are learning from various initiatives that are happening in India, such as the network of you know, doctors leading the fight against air pollution. We're able to then provide the evidence and sort of say, this is what we're seeing in our consulting rooms, and how can we ensure that there's preventative aspects, but also policy in terms of how are we diversifying you know, energy generation, and moving from fossil fuel based energy production to renewable energy. And you know, the contention obviously there is quite huge. As far as that discussion is going, we are working with the Democratic Nursing Organization of South Africa, because we believe that nurses are often overlooked, but play a major role as far as primary healthcare service provision. But the idea of you know, being preventative and not curative is really a focus that we wanting to highlight. We're working with the Public Health Association of South Africa. We have a climate, energy, and health special interest group that that really speaks to advocating for you know, a new healthy energy policy, but really mobilizing health professionals in their different cadres, researchers, NGOs, and various experts to sort of then speak up at national policy level, at local level, but also at primary healthcare level. We have seen you know, a lack of visibility of health professionals in really partnering with communities to amplify their lived experience, but then to also then corroborate with research and what they're seeing in their consulting rooms. So really this is what we are continuously advocating for in trying to partner with health professionals across the board, learning from those that are able to develop policy, but also you know, basic carving of what kind of health services are fit for purpose for those who are exposed to respiratory illnesses throughout. And I think I'll end there so I don't take too much time, and I'm hoping to engage further with the question and answer. Thank you.
Thank you so much, Mafoko. You brought up so many issues that we haven't yet discussed, including using health providers, their expertise to provide evidence and attribution, litigation as a tool, looking at health systems, health systems transformation, including restorative justice, diversifying the healthcare providers involved, creating partnerships with the community. That was really fascinating, and I hope there's more time to discuss in the Q&A. And so with that, I will pass to Dr. Sharon Friel who's the director of the Planetary Health Equity Hothouse at Australian National University. Sharon.
Thanks a million, Marta, and yeah, thank you for the invite to come and be part of this. Delighted to join my fellow panelists. So I want to talk, I suppose, particularly as a researcher. As Martha said, I head up the Planetary Health Equity Hothouse, which is really it's a research centre at the Australian National University, and we have quite a particular research agenda, which I'll share with you in a second. And I'm going to speak about the research in the context of what a colleague here in Australia often reminds me, and he heads up one of Australia's most progressive think tanks, and he always says, evidence matters, comma, sometimes. And it's that messy, messy world of evidence of all shapes and sizes in the mix with the dirty politics, with all the policy chaos, with all of the sort of advocacy movement taking place, and evidence is in there sometimes. And different, of course, there's lots of different types of evidence. So I just kind of wanted to share what we are doing in that space, recognizing that evidence is in that messy, messy environment. So I will share some slides. I don't really want to spend what we're interested in the hothouse is planetary health equity, and I won't spend any time talking about the evidence that makes the connections between, particularly with climate change. But so if planetary health equity, as we define it, is the equitable enjoyment of good health in a stable Earth system. We focus particularly on climate change, but it's not, of course, just about that, but just for the sake of our capacity, that's what we focus on. And so we look at this intersection between climate change, how that's interacting with inequities, both intergenerational, economic and social inequities. And Paula and Mafoko were really pointing to those that exist across society, and how when you put climate change along with these different forms of inequities, this contributes to and exacerbates existing health inequities between countries and within countries. And I don't think we need an awful lot more evidence relating to that. What we've started to focus on is really trying to problematize this, what we call the consumptogenic system, because we're very interested in prevention, very interested in understanding how to mitigate against further climate change, how to reduce and prevent inequalities, and ultimately how to improve health equity, and reduce health inequities. And the argument being, and the evidence supports, that there are these common underlying system drivers called different things. Paula has already importantly pointed towards the commercial determinants of health that are part of this mix. But really what we've been examining is this web of institutions, of policies, of commercial activities, and of institutional and social norms that basically they incentivize, they reward the excessive production and consumption of fossil fuel goods and services, which of course are incredibly harmful for the environment, but they're also incredibly harmful for human health, and they're also very unequally valued and distributed globally. So what I think is really important is not only do we understand the consumptogenic system and these core common drivers of these outcomes of planetary health inequities, but asking the question of why has there been so little remedial action, effective remedial action? And then really importantly, because I just cannot bear the idea of talking about despair all the time, really importantly, trying to understand the conditions that enable effective action, effective change to happen. And again, we've already heard like some of that action, some of that effective action from Paula and Mafoko. But as a researcher, I want to help generate evidence that we can apply across different contexts for different issues that matter within this consumptogenic system and that improves planetary health equity. And so fundamentally, these to me are questions of governance. So if today's contemporary governance, and if we think of governance as the actors who are influencing the course of events, there are a number of different categories of actors that are in the mix of action to do with climate, health, equity. There's, of course, state actors and government actors. There are the market actors, and there is civil society, all in the mix. And then there's all sorts of combinations of these, think of public-private partnerships. They might be considered hybrid. And I try to draw little lines to suggest where the power lies in contemporary governance. And you can see the bigger line sits down in the side of the triangle that is related to the market. So fundamentally, from an evidence generation perspective, we have to ask questions of where does the power lie in contemporary governance? Because at play, when we ask questions of power, there's lots of different ways that we can conceptualize power. I'm just drawing on these ideas, interests, and institutions, because I think it helps us see power in operation and see the sites and the places and the dynamics of power. Because if ideas are telling interests, and I'm going to explain this in a wee bit more, ideas tell interests what to mean. And we hear a lot of discussion about the different interests at play. But if these are being sort of guided by or told how to behave by ideas, ideational power, and interests are telling institutions what to do. And if institutions are the rules and the norms, then those interests are basically setting the rules of the game. And then it loops back to the institutions then telling the ideas, helping the ideas how to survive. And on we go with this vicious cycle. And these different ideas, interests, and institutions are swirling about in contemporary governance. And so if we think of what does the current system look like, and we've done some analysis related to this. But if the current governance system, what are the dominant ideas at play, and certainly over the past few decades? So ideas of colonialism, of neoliberalism, of market supremacy, of individualism. These are these dominant paradigms, these deep core beliefs that are embedded in our everyday lives that basically tell interests what to be. And so it's no surprise that economic growth, unfettered economic growth, profiteering at all costs are the dominant interests at play in our governance systems. And then the institutions that are in place that enable these interests to go forth and survive and to be and to continue to be the rules of the game, if you like, and the norms. We have institutions all about free markets, I put in inverted commas, institutions about trade liberalisation, trade plus, of deregulation, of financialisation. Paula spoke about the financial actors that sit behind some of the big corporations, like the fossil fuel industry, owned round about 30% of the shares of the big agri-businesses that Paula was speaking about are owned by the world's three biggest money managers. And those same three money managers own also about 30% of the shares within fossil fuel companies. So we live in this financialized world. The rules of the game are set in place. And then I won't start on the whole issue of new managerialism. I'm in a university environment. We're becoming more corporatized by the day, all because of the joy of new public administration. Anyway, that's for another talk. But so from an evidence generating perspective, what are the conditions that enable change to happen? Well, what are the conditions that enable the embedding of a new paradigm, of a new idea? What are the conditions that enable ambitious public policy? So questions of policy coherence, questions of co-benefits, depending on what language you like, policy coherence, co-benefits, health in all policies, equity in all policies, climate in all policies, intersectoral action. But what is it that enables that? What does it look like, and what enables that to happen? What is it? What are the conditions that enable the taming the beast? So again, the discussion around service providers, or the questions around regulation. I would argue we've been saying for decades, probably all of us on this call have been saying for decades, we need better regulation for all of the sorts of industries that Paula has been speaking about. But asking the question of, and I should have prefaced this by saying I don't have the answers yet, we haven't finished the research. But asking the question of what is it that enables a government to step up and be courageous and actually put regulation in place that tames the beast, prevents the sorts of harms that we see from some of these companies and industries. But also, what is it that can be done by progressive states to incentivize different business models or different investment models? So think of some of the ethical investment discussions that are going on at the moment. I would say that's still absolutely at the fringes in the market domain of governance. But imagine if that was incentivized, if that was controlled in a way that really made sure that there was no business or investment activity that was not in favor of planetary health equity. And then the question of trying to understand how influencers are influential, and particularly here I'm thinking about the role of civil society and the role of social movements. So that sort of strategic mobilization. So one idea of how to mainstream a different possibility. So there's discussions going on at the moment around well-being economies. There's other economists are talking about sustainable prosperity, or Mariana Mazzucato's idea of this mission economy. We need much, much more research about the effectiveness of these different ideas. This is a new idea, a new paradigm. How effective might they be? And then again, more importantly, is how to embed these into government policy, basically. And that's about building an economy that's in service of people and planet. And that's, of course, a complete motherhood and apple pie statement. But we need evidence that to generate evidence that is going to help us understand how to embed that. And then finally, the influencers. So we're here because we want to channel the outrage. And I think it's really important that we do that in a strategic manner, understanding from analysis of previous campaigns, of previous social movements, of previous coalitions. What is it that has been effective in winning against some of the big corporate powers, against some of the conservative elites? What is it that has been effective? And so some of the evidence, some of the analysis, we've done some of it, but there's a whole social movement literature that tells us these 5 things are important. One is, of course, around raising collective consciousness. That's the importance of civil society and coalitions more broadly. We have seen in the past where there's been success against big pharma, for example, and I'm thinking here in the context of trade agreements, where the presentation of evidence framed, persuasive framing, so evidence brought forth at a particular time by particular actors in particular venues was very, very effective in helping to secure the Doha Declaration for Public Health in the TRIPS trade agreement. The use of persuasive framings, persuasive narratives, that's about discourse, discursive power, saying things in certain ways that captures, that activates, that channels, helps channel that outrage. And then, of course, and it sounds really simple, but it's not always an obvious ask, is what is the political commitment that is being pushed for? What is the actual ask? And then holding both the government and others to account. These have been seen to be very important. So to me, if we are going to do something about climate change in a way that's good for social equity and health, and we think evidence has a role to play in the mix, it matters, sometimes, then I think some of this type of research is going to be incredibly important. This takes us out of the traditional public health or perhaps health systems space. It's absolutely about political science, about a whole suite of social sciences that have to be brought to bear to ask the question of how do we make change happen? So thank you.
Thank you so much, Sharon. It was very helpful, I think, to zoom out as we begin to think about the implications of all of this, and to hear your closing thoughts on the very important question of how we win and effectiveness, which should be central to any exploration of this. So we have some questions, and I just want to note for the audience that our initial intent when we were going to do this in person at Health Systems Global was to have small groups and have people sort of discuss how they might think about some of what we had discussed in terms of its implications for our own practice. That's going to be quite difficult on a webinar, but I encourage you to kind of take that spirit to your questions. There are some questions in the Q&A that are about health systems adaptation that I'll try to handle typing. And maybe Mofoko or Paola, there's a question here in the chat that one of you might be able to answer about how the news media can adopt a preventive approach to these health issues, what strategies can amplify community voices for environmental justice, and how can media partnerships and visibility of health professionals enhance public health interventions. This is from Satya, a colleague in Nepal. Is either of you willing to talk some about working with the news media? You're both nodding. Okay. Mofoko, do you want to go first?
Sure. Thanks, Martin. Thanks for that question, Satya. Yes, I think the media plays a huge role in amplifying, public health messaging, but environmental justice issues. We partner a lot with a lot of media houses, where we sort of invite them for our events, but we also ensure that the messaging is factual. And we encourage them to also partner with research institutions and experts so that the science is communicated in an evidence-based manner. I mean, we saw the role of the media during the COVID-19 pandemic, how powerful the media was in terms of ensuring that the messaging is correct, and ensure that local media houses or your local radio stations are empowered as well, not just national, because they have a wider community reach, and people can rely on the messaging. So I think definitely the media can play a role, but also the media partnering with professional public health associations, like I mentioned, research institutes, and really trying to ensure that the messaging is correct. And yeah, thank
you so much, Paula.
Yeah, no, totally, and with Mofoko, media, it's key. And I think there are several different strategies that can be used. And I'm also like in full agreement. It has to be based on the evidence, the best data. But there are several kind of creative ways of generating like facts around the data that you have. And one of the things that we have been used in the last years, and I think it's been very effective, it's to support investigative journalist groups. So we do that's a really a suggestion for NGOs in general, for universities. We kind of hold workshops to present all the data and the evidence we had on a certain topic, for example, healthy food, whatever. And then we invite
I think Paula's frozen for me and for others. So hopefully we can. Okay. Other questions that people want to share in the chat? It looks like we can't actually have people ask questions live. I'm sorry. But feel free to put questions in the chat or in the Q&A. I hadn't yet answered the question about funding opportunities available to support health systems in transitioning to renewable energy sources, particularly in low-income countries like Sierra Leone. Does anyone want to answer that question?
Martha, I can put the link to the Global Green and Healthy Hospitals that I mentioned. It's an initiative from Healthcare Without Harm, And this is a network of hospitals and health systems and health facilities that then embark on ensuring that they work towards being climate smart. And they have about 10 sustainability goals that they choose from, energy being a major focus area. And they kind of then, work towards trying to figure out how to move from, whatever energy system they're using to a more efficient one, a more that is, less carbon intensive. And so it's around decarbonizing the health system in general. I've put the link in the chat. Hopefully that can give guidance around that. The funding aspect, I'm not well versed on that.
Not either, but thank you so much for the link and answering. Paula, you're back. Do you want to finish what you were saying?
Yes, thank you. It's so typical, right? That's exactly when you were speaking that the technology fails. Well, so I was saying that we have succeeded in really getting good coverage through these workshops where you present the data, and sometimes it's not something overnight. I think it's an investment that you do in the long run to develop those relationships. And I have a current example. We have been trying to get the evening news for years around ultra-processed foods. And one of the journalists that attended one of these workshops for 2 years ago happens to be one of the producers for the evening news right now. And we finally got it. So I'm saying that one of the important issues with media is you have to develop long-term relationships with journalists that are committed to the issues, and you have always to have the best and updated available evidence that exists that you keep on feeding these people. And I think it's a really important part of the work in general. Just say that I will fully support that. We need that. We really need that, and there are ways of doing that. But in the long run, not necessarily immediately.
Thank you, Paula. And we have another question in the chat about corruption. So participant saying, in South Africa, a major issue is corruption. Many government ministers are directly benefiting from continued fossil fuel use, which leads to huge resistance to changing to more renewable sources of energy production. How do we overcome something like corruption that is so deeply rooted? And I think we heard about sort of accepted legal forms of using commercial pressure and fighting regulation, and this may be alluding to illegal ways of doing that, but they both present enormous obstacles for sure. Sharon, do you want to take a first stab at that, and then we can pass maybe to Mafoko, who's in South Africa?
Yeah, I suppose there's a number, well, there's no easy way, of course. One consideration is the role of civil society to really be monitoring, to call out with safety considerations, of course. But that sort of constant monitoring and trying to create transparency and accountability is a very important role for civil society. Some work that colleagues have, a colleague had done in another part of the world where the same sort of experience was taking place was kind of the quiet resistance of some of the bureaucrats, who weren't corrupt, and with just sort of things like just very quietly trying to be in the room, and that creates a sort of a regulatory mechanism in sort of a very soft power, if you like, but sort of you're trying to prevent there being trying to prevent the opportunities for hidden corruption, hidden deals, hidden interactions to take place. And so, yeah, just kind of putting themselves into the room or into the correspondence So that kind of inside-outside approach, inside the bureaucracy, outside through civil society, can be an effective way, potentially.
Well, Coco, anything to add?
I think, yeah, no, Sharon took the words right out of my mouth. And I think that's the role we play as NGOs and civil society, that insider-outsider approach, where we do have a seat at the table because we are engaging with communities and, we're representing we're enabling them to represent their lived experience. And that outsider role where we do engage in, strategic litigation where there's a need, right? But I think what Sharon has mentioned around civil society having a seat at the table is really paramount. And that is also facilitated by them understanding governance in general, right? Understanding environmental governance, understanding what has the Constitution promised, and how do we ensure that there's somebody that is holding, the state accountable consistently. And so we engage a lot in, around, environmental health literacy workshop, but in getting civil society to have a better understanding of environmental governance broadly, so that when they do have a seat at the table, they're able to engage meaningfully. And I mean, needless to say, there are a lot of, transgressions around people that are trying to defend the environment, that are trying to defend human rights, because then they get targeted. And so we're also really trying to amplify around human rights defenders in that way. But really, partnering with the media again, the idea of whistleblowing is often not a popular one because people then get targeted, but it is we actually working towards having some form of framework where human rights defenders are then protected by the state itself. Thank you.
Great, thank you. And spotlighting human rights defenders is something that we definitely do at Amnesty as well, right? In terms of protections and amplifying their messages. So we have 1 minute left. I'm looking at one question that might be a good frame for concluding remarks from the panelists. This question is, how have you managed to engage health actors with more activist approaches? Often health and academia is not so amicable to advocacy due to either wanting to be neutral or not having the skill set. So maybe if each of the panelists can kind of provide concluding remarks and consider that question in your answer. Paula, do you want to start?
Sorry, Martha, my connection wasn't stable again, but I'll go for the final remarks, right? That's it. Yeah. Okay, I think I will make a comment on one of the questions that is in the panel as a final remark to highlight the importance of exposing conflict of interest and ensuring that we are transparent in the source of information, because I mean there is a question here about the dispute around some issues. I mean, some cases there are good, legitimate scientific dispute around issues, right? But in some cases, it's a deliberate way that the economic actors fight against really sound evidence. So I think it's really important to expose conflict of interest, and I think it talks with other issues that have been mentioned here earlier, including corruption issues, right? So you really need to do these good and important liaisons and connections between academia and civil society organizations that can expose that. And I think it's key to have full transparency on the source of evidence where it comes from, and release conflict of interest information. Because in my experience, a lot of the so-called controversy, in many cases, it's not so much about the healthy controversy or the healthy discussions on evidence, right? It's more front groups fighting against really sound and good evidence. So I think it's important to differentiate that. So be aware of conflict of interest. Thank you.
Great, thanks, Paula. Mafoko.
I think health activism is definitely an area that's underrated, but I think I'm very passionate about it. And I think health professionals have been activists in their own right since time immemorial, looking at, the different advances that we've made in terms of cure and treatment. And I think health professionals themselves don't realize how, actively they've been in the forefront of, innovation all the time. But often it's around, them shying away from actually being referred to as activists. But they have been activists, and I think it's something that really needs to be amplified. But I think also, there's something to be said about collective power, right? And coalitions, and not working alone in trying to, demystify the idea of, activism as it normally presents, a contention with health professionals. But we really need health professionals in the forefront. We need them in the political discussions around, fossil fuels and climate change. And climate change is a health crisis. And so it's really important to have them in the forefront. Thank you.
Thank you, Sharon.
Yeah, I mean, I think, again, sort of as an academic, the only reason I want to be an academic is so that I can produce evidence that's useful for advocacy purposes. And there's lots of different ways then that you can use that. We were saying, the inside or the outside strategy. Some people will use it whilst they're sitting around a policy table, a committee, for example. And then others will go out and be involved in protests about things that align with, and everything in between. And there's a role for all of that. The evidence tells us that it's the combination of inside and outside strategies that make change happen. So I don't see them as two separate worlds at all.
Thank you so much. So a resounding, healthcare workers and providers are activists and can be. Remco, any concluding remarks?
Thank you, Marta, Paula, Mafoko, Sharon, for this excellent webinar, sharing of examples, concepts, and work ahead. I really appreciate it. It's part of a series of work in progress that you are organizing with your institutions as well. We're happy to contribute to that. So I see it as a knowledge action coalition that we have to expand in different places, not only at the global, but also at the regional and much more at the local, interdisciplinary, and with those working on justice and human rights outside the healthcare sector. But we as health actors, health professionals, health researchers absolutely have a role. So I'm really looking forward till the next phase of this. I'd like to thank also my communication colleagues at UNU for making this possible. Excuse me for some minor technical glitch from my side. UNU as a think tank working also with member states is trying to see as well what kind of member states is willing to take this kind of action forward, also to do the policy advocacy for those that are having to make the decisions at the more global policy level, also the different UN institutions. So that's our role. I will keep it with here. Marta, the last word is for you.
My last word is thank you to the panelists and everyone who helped, and thank you so much to the attendees for your interest, attention, and fantastic questions. And I wish everyone an activist-filled day in whatever form that takes for you. Thank you so much.